Good. That side for me. Twist. Exhale. Good. Face up for me. This side go right here. A little bit chin up. There we go. Very good. A little bit. There you go. There we go. Yeah. That little tension was holding that back.
Yeah. It's a little sore, but I can take,
You must do yoga.
Ta-da!
Very good. So Sarah, I know you've been coming here for about 13 years or so. I
Yeah.
had some pretty deep care with my father and I for a
Yeah.
while.
Yeah.
And so this is going to be a little bit of a deeper visit today. We're going to go pretty deep on her. And so if people get scared on YouTube, it's because Sarah's pretty familiarized with our care here.
Yeah.
And I've done pretty deep on her for years. And
Yeah.
So, all right.
I'm a lifer.
Head back for me. Exhale. There we go. Let it all go. Breath in. Exhale. Let it all go, Sarah. There we go. Let it go. Deep breath in. Last one. Exhale. There we go. Good. Side face for me. Deep breath in. Exhale. There we go. Good. That side for me. That side. Exhale. There you go. Twist. Exhale. Good. Face up for me. Yeah, we've pretty well worked through a lot of the lumps and bumps in here. I don't think there's any.
Yeah.
I think it's moving pretty smoothly. Even the sound on the adjustment, sometimes we'll get, even how loud the adjustment is sort of tells you how far the joint's out of place. And when I adjust your back and your neck, it's like everything's usually pretty soft in here, meaning the distance is not that far. You get those loud pops, like, big distance that bone has had to move to get back to where it's supposed to be. And as you master the care in here, sometimes it gets less and less loud.
Yeah, I get adjusted a few times a week, so
Yeah.
it's hopefully there's not much left.
All right, let's see here. Turn it left. Here we go. This side go right here a little bit. Yeah, there we go. Turn it right. Yep. This side go right here a little bit. Chin up. There we go. Very good. Okay. And your work right now is seated?
My
what's
work is a combo of activities, but I can sit for a long time. So I really try to avoid that. But I also do a lot of filing of heavy files, and so it's coming up now, tax season, since I work for a CPA.
I gotcha.
I generally run into some low back issues.
Just from the
From
files
that.
lifting and.
Yeah, I try to squat. I try to not bend at the waist, but
Okay.
generally speaking, they're just really heavy files, and there's a lot of them. So I'm trying to avoid any low back issues as we come into tax season. Hopefully,
I know we've taught all this, so one of the pieces of even the lower back is the neck. So the more, even though we're lifting with our legs, the holding of files, and then even the head being forward puts more torque on our lower back. So, it might be like, why are you working so much on our neck? Well, we got to get the head back as much as possible, and keeping your head in the right position helps to take pressure off your lower back. So making sure we get chest in, head back, and then, right, that'll help take some of the stress off the lower back. I know, we're trying to see if I can find
feels
anything on you.
good. Are you finding
Oh,
anything?
I'm trying to see here. I'm trying.
I bet
a
you
tiny
could.
bit right there.
I bet you could find some.
It's a tiny bit right there.
Is he ripping your skin off? Sarah? Is it violent?
No,
Is it awful?
it doesn't hurt at all.
Tell the YouTubers it's not that bad.
It's not. It doesn't hurt at all. It feels kind of rough, but it's most likely my rough in texture because my hair is there. But it doesn't hurt. It actually has like a warm sensation.
Yeah, just
So,
getting all that blood flow in there, oxygenating the tissue, relieving some of that, just tension that gets accumulated in here and unbinding it. A little bit right there, right at the top. It's hard to see, but right there at the top a little bit. what's normally supposed to happen with the combing and the gua sha is that the skin becomes pink, like a flushing of the tissue, and then when there's that darkening, that's when there's been some lactic acid, some cellular exhaust that's been trapped in the tissue, and we're trying to oxygenate the tissue to bind to that lactic acid to form carbon dioxide and water, and that helps to release some of the acidity and make the environment that the nerves are sitting in not so acidic, so that they're not so easily irritated, and that they can communicate, the brain can communicate, properly with the body, not having these interference and acidity, conflicting with the signals. A little bit bigger, a little bit, you can sort of, a little bit more on this left side. There we go. I'm just going to check, see a little bit more on this right side here. Let that go right there. Chin up for me a little bit. There you go. There you go. Yeah. That little tension was holding that back.
Yeah. Oh, that's much better.
Yeah, that's the stuff. That's the stuff.
Yes.
And that's how I feel. I've been adjusted 6 days a week my whole life, and it's like, yes, thank you.
Even the most diligent, people, for me, it's still my nemesis is the neck. It's just,
a lot of dancing, you said. Okay, well, we'll see how these toes are going.
yeah, I tried to do some practice this week on my own and clean up my double pirouettes, and I kind of, my feet took a beating, or a lot of calluses on my feet because of it.
Yeah, the more the weight's on your toes, the more these toes get jammed. See this? You must stand more on your right foot. These toes are a little bit more, unwilling to separate from
Yeah.
the tarsal. And the metatarsal joints are a little tighter on this side. There you go. Let the ankle go. There you go. Good. It's okay.
Oh,
Yeah.
that feels good.
Yeah.
Wow.
Unbind that ankle a little bit.
The first day I tried a routine, I think it was Monday or Tuesday. And the next day my quads were so tight because it'd been so long.
Stay there, stay
And I could barely walk downstairs. So I just kept at it all week, and then as the week wore on, then it got better and better. But oh man, I did all those deep plies. I was doing crazy stuff first day, like, oh, this is fine. And it was a rude awakening because I just hadn't done that stuff in a while. I tried, I think I did it properly, but it didn't matter. I was just not used to doing it. And
Oh, right there, yeah.
yeah, it was like Wednesday. I couldn't really do stairs very well. But it's part of getting back into it. Anytime you stop dancing and then try to go back, just like if you stop doing chiropractic and try to go back, it's gonna hurt.
Yeah.
It's just gonna hurt. Oh, that one.
Oh, right
Oh
there.
man, oh man, oh man, oh man. That hurts. I'm not acting.
I can feel it though. There's a
Oh,
right there.
Oh man. Oh my
oh yeah.
gosh.
See how the hamstrings are doing here. No.
The calves, the hamstrings, for some reason I could take today.
Okay.
I don't know. Is this leg too close?
You're fine. You're fine. You're good. You're good. I'll move things if I have to. Oh, there we go. Right there. Right there.
Yeah. I know you're being nice.
Oh, a little more.
Oh. Oh, okay. Oh.
Okay. All right. There we go. Yeah.
Okay.
title of the video. Okay. Okie dokie. Not the calf. Dr.
Yeah.
Bo has not been massaging that area, okay?
Exactly.
I'm cleaning all these other areas, but
He does the hamstrings and the hips, but he doesn't touch
the calf.
the calf though that you found the spot. You're exactly right. Okay.
Dad's been missing some spots.
Yes. He missed the calves.
Just missed the calf. Okay. Clean out all the rib heads. Usually we focus so much alongside each side of the spine, getting the vertebrae moving, but these are all, I think we've gotten this all pretty well clean, so I'm going to sort of check on these rib heads out here a little bit more. Usually Dad doesn't go way out here as much, and where I was all dirty when Brenda was working on me. I was like, because Dad had, my spine was clean, and then on the outside Brenda was gouache on me.
Is that where she got you?
All got me over here on the sides, yeah.
Mm-hmm.
Used to call them cheater spots.
I was just gonna say that.
Cheater spots.
Cheaters. When I sing a lot, the diaphragm area gets so locked up.
Mm-hmm.
But now that I'm not singing as much,
It's released.
it's better. But when I'm singing every day, there's just
A lot of tension here.
something that happens. It's like you keep snapping it. Your diaphragm and muscles around the back and everything. It just, there's not really much I've been able to do about that over time. It just is something that happens.
Sure, singing puts it's a lot of work on that muscle. And
Singers and teachers, I bet, right? Teachers like,
right. Talking all the time and or singing, gee whiz, a lot of force all the time. All right, there we go. Nice and smooth, no big speed bumps in my highway. Should not be any.
does it look symmetrical?
The left side was a little higher, but now that I've pressed it in, it's almost like now the right higher. So that both are responding to care. It's
Okay.
how quickly something changes will tell you how long it's been there. So if it changes quickly, it means that you just, it's like a little bit of plaque and it goes away real quick. But if it's been there a long time, it takes more scrubbing to get rid of it. Main purpose is that, like I've said many times, is just make sure your whole spine ages evenly. That's all that we can really ask for. Is when we make it to 60, I want my whole spine to look 60, and that's okay. Right? It's not abnormal to look your own age. It's abnormal to have parts of your spine be 90 when you're 60 and parts of your spine be 20. Right? So you have an uneven aging is the whole message and goal here is by keeping everybody working, our spine is allowed to age evenly, and then heaven forbid any trauma happens, the forces are spread more evenly throughout the spine, not all harnessed in one area. And so how valuable is that? How valuable is it that if you have an injury that it's not going to be of much severity because your whole spine's going to be participating. So, and how do you know if something's participating? Well, if I push on it and it's the end of the world, it's probably not participating. Size of a person doesn't matter in terms of the amount of pressure they should be able to handle. The spine should be able to handle a significant amount of pressure, small, big, medium, whatever size. The body, the joints in the spine can handle quite a bit of force. I remember watching a video on the Yamaguchi lady, doing a triple axel, and they said when she lands the triple axel, her knee has to withstand like 760 foot-pounds of torque when she lands on one leg, right? And it's all leverage at that point. So in terms of leverage and torque, your spinal joints are handling, close to probably 1,000 pounds of force when you're jumping up and down or moving around.
Yeah.
You know, it's like, well, can't you at 180 pounds really hurt me, Ed? It's like, no, because these joints actually segmentally handle well more than what my father and I and Brenda can put out. The torque that they're handling is high.
Right.
Mhm, mhm. There it is, yeah.
Oh yeah, I can feel that. Bonus adjustment.
Bonus.
It's like they're all folding down.
Right, it's like a roof, like one of those
Yeah.
shingle or like tile roofs. They all have to fold on each other. And like almost like when we get injured with the ribs raised. We, gasp or raise our shoulders, or we get scared. So the body gets injured, and then the ligament that's supposed to pull the joints back down, the rib heads back down, gets so stretched out that we end up just staying in this upper position. And keeping the ribs in an up position actually is less work, because now you don't have to keep raising and lowering the rib every time you breathe in.
Uh-huh.
The issue is that now the nerves are not very happy.
Yeah.
Let's see if Dad's done this for a while. I know. Sort of unlocks that. Yeah, right there.
Ooh, that's gnarly.
Let's try the other side. It's like glue underneath our scapulas. It never gets access to get underneath there. It's like underneath the fridge. Yeah, that's where all the crumbs are.
I wish I had a picture of the first time
Oh, I
you did
remember.
this.
Oh, I remember, yeah.
I really wish I did. Oh my god.
I was like, Dad, where are your phone calls?
Right. It was like a blackish blue color.
Mm-hmm.
It was so disgusting.
Mm-hmm. Yeah, there was less parts of your back that weren't marked, right? Your whole back.
Yeah.
Mm-hmm. There wasn't just little areas that were marked. The whole thing was.
It was like a puddle.
Mm-hmm.
It looked like a
Mm-hmm.
dark puddle in the middle of my back.
Mm-hmm.
I had a few people say, Sarah, do you want to talk to me about something?
Mm-hmm. Yes.
I said,
Yes, I do.
I have a really good chiropractor.
My chiropractor's been very, very hard on me. Yeah, this is the rib head joints right here, the lateral. I find when these joints get really inflamed, it's like after we release all this, it's like you get up and it's like, wow, it's so much easier to breathe. You don't realize that it's like the Tin Man from Wizard of Oz. Like you need oil and lubrication on these joints for breathing, and when they get so congested in here. But yeah, same thing with my back. It's like, this is all, I can't make a mark on your spine here, Sarah. This is all clear. A little bit up here in your shoulder blades, like right there for the neck.
Yeah.
But only the rib head line is really where I'm getting.
Yeah, right there feels like a little itchy.
Yeah, right there is a big mark coming out right there.
Yeah.
These are kind of ancillary areas. The main goal is to clean the spinal column. I think, there's, but you gotta clean out all this too.
Oh, that feels good though. I feel it like release
Mm.
over there.
Yeah, good mark is coming out.
Yay.
Yeah.
Get it, Dr. Ed, get it.
How did you know? That's exactly what I'm doing.
Is she
Why can't I break?
bleeding?
Why can't I break any
What's
capillaries right here?
happening?
Well, maybe he's just not combing as hard right there. You understand? The marks are only coming out where there's an internal, and Sarah feels it. She's like, Ed, there's something, I can feel it internally.
Itchy, yeah.
Yeah, there's almost like a internal. So a mosquito bite, when the mosquito
Yeah.
bites you, he actually puts some of his saliva in you, and obviously mosquito saliva is a toxin because it doesn't belong in your body, and lactic acid doesn't belong in your body either, and that irritation in there is what you're able to feel almost as if it's an itch that your body's trying to draw attention to drive out of the tissue. And but I can't. I mean, very little alongside our spinal column, and it came out very deep on the
Yeah.
outside. So the combing doesn't make the mark; it's what's inside that makes the mark come out.
And I can tell it feels smooth there.
Mm-hmm.
Smooth underneath.
Mm-hmm.
And then when you go to the
Yeah.
edges, it feels a little rougher underneath.
Right. Interesting little mark right there.
Just a random spot.
Well, like some scar tissue or some, like you're seeing like lymphatic, connections in there. There's adhesions inside. Start with this guy. Bring your arms up for me. Put your forehead on your forearms. Keep that forehead to forearm contact. There we go. I'm just gonna breathe. I'm just gonna lift you up and just stretch. You all right?
Mm-hmm.
Breath in, stretch. Good. There you go. Breathe in, exhale, stretch. Good. All right. Good. Stay right there. It's already moved. All right, I got you. Breathe. Okay, breathe. Good, breathe. There we go,
Wow.
good.
I think you got me moving pretty well.
Mm-hmm.
I do this to myself, but not this hard, I don't think.
All right, tilt your head to the left a little bit for me. There we go,
Oh, cool.
good. Pretty well. Let me see here.
That's awesome.
Yeah.
Okay, I'll be here every Saturday.
It was definitely on the upper part. There's some adhesions in there.
Oh,
Yeah.
that felt good.
Mm-hmm. All right, tilt your head to the right a little bit for me. Relax. There we go, good. Yeah, that side's bottoms are good. And this
I
top
feel a
part.
little like crackling. A little.
Mm-hmm.
It's good.
That sounded like a neck adjustment.
It did.
It sounded like.
Wow. I always pull this ear and try to get some movement out of it, but I can't do it as hard as you do
Get those
on
drain
myself.
lines. All the drain lines go down right behind there. I think all that.
It feels like fire now.
Definitely
Like-
that upper part was clogged. The lower part was open, but.
That feels really good now.
So as we get, more towards being a black belt in my office, we call this cervical extension traction. Chiropractic biophysics started off with this. Let your head go back, Sarah. There you go. And the purpose of this is to stretch the front ligament. So there's a ligament underneath your esophagus that is so tight that keeps us pulled back forward. So even if you adjust the segments in the back of your neck, that tight ligament on the front will just pull you back forward. And so we can sort of start with it with a neck Denneroll, which is a piece of foam that holds you here. But a deeper way to do it is with this called cervical extension traction. So we first have the head just into extension, and then we introduce some weight to help provide more downward force. And so what that does is it helps to hold Sarah into extension. So this is where it's an overcorrection. So because we've lost the curve in our neck and the neck is straight, just asking for this is not enough. We have to take you back and then hold you there for about 20 minutes. And then when you come up after this, your neck will retain some of that stretch that we've induced into your neck and retain some of that lordotic curve. And this is sort of an advanced, we have to make sure all the joints in your spine are moving evenly, and that the whole neck is able to handle going into extension. See, if you only bend in your lower neck, then you'll pinch something. And so we want to make sure the whole neck is bending evenly. So generally, this is usually a few months into care, we begin extension traction to restore that cervical curve. Pretty much everything sort of stems from the loss of that curve, the head going forward, jaw pain, headaches, TMJ, stomach issues, heart issues, all come from forward head posture, neck tension, shoulder tension. So, very good, Sarah. And then you come up, just look straight forward. There you go. Yeah, so you sort of retain some of that curve.
Hang out and just put the head up.
So by lifting her bottom, she's got good downward pressure on her upper thoracic there. And then letting her bottom sink in, she's able to then go into extension and really stretch, get pressure on the middle back. The roller allows her to move around.
And then where I feel it's the most restriction, I kind of try to stay there and then let my butt go on the floor, and I should move that so I can let my head go all the way. You got most of it moving, so.
She's all limbered
Yeah.
up, ready to go.
When you do this, how often would you say throughout the week do you stretch?
Every day.
Okay. Yeah.
Every day. If I don't,
Bad
I
things.
pay for it. I could skip a day, but I shouldn't really. But do you want me to try the Denneroll? Because I could.
No, that's good. That's good. This is the good.
Okay.
This is. I want to show people that this is not supposed to be the end of the world. That,
No.
I think it feels good to do this.
Oh,
Like when I
yeah.
get on it at night, I'm like, yeah.
Oh, it feels great. And I just try to reach this all the way.
Eventually, something you look forward to. It's like a
Oh, yeah.
way of giving relief to your back and counter stretching.
A good day is when I do this at lunchtime. If I go home for lunch, I'm like, get down on there. Even 5 minutes makes you feel much better.
Sarah, why are you late for work? I was stretching my back.
Of course. If I could do it at work, I would. That would be the best.
There's Sarah laying on the roller.
And then sometimes, if I don't have Dr. Ed or Dr. Bo around,
Get the legs a little bit.
Yeah.
I'll do this. Of course, you already beat them up pretty good. Yeah, this feels like nothing right now compared to what you did, but I could do one that ups it. And just try to get as much of my
Right.
weight
It's
on
a lot
there.
Yeah.
It's a little sore, but I can take,
You must do yoga.
Ta-da!
Very good.
Cool.
No, thank you, Sarah.
You're welcome.
Thank you.
Thank you. I feel really good.